This part of Unit 12, the functional nervous system, looks at Part B, the peripheral nervous system, and Part C, the autonomic nervous system. Let's begin with Part B, peripheral nervous system. We'll discuss the cranial nerves and the spinal nerves. The cranial nerves are those nerves attached to the brain. 12 pairs exist. They innervate structures in the head and neck, except cranial nerve number 10, the vagus. The axons are located in the nerves. Motor neurons travel from centers in the brain to the muscles, whereas sensory neurons travel from the senses to centers in the brain. The neuron cell bodies are located in ganglia if it's a sensory neuron, and in the gray matter of the central nervous system if it's a motor neuron. Sensory nerves contain only sensory neurons. Motor nerves contain only motor neurons, although all motor nerves have a sensory function in proprioception. We'll discuss more of that later. Most nerves are mixed with both sensory and motor neurons, as shown in the figure. The nerves pass through holes in the cranium. Injury causes loss of function. The following table summarizes the cranial nerves. Two types of neurons in the nerves would be M for motor only, S for sensory only, and B for both sensory and motor nerves. Let's look at cranial nerve number 1. It's called the olfactory, and it is a sensory nerve. It passes through a structure called the cribriform plate that's in the roof of the nose. It's the ethmoid bone. The nerve arises from nasal epithelium, and its destination is a structure called the olfactory bulb in the brain. It functions in smell. Injury causes loss of smell as well as poor taste. Usually this is permanent. The taste is poor because, to a great extent, your sense of taste is really smell. Number 2 is the optic nerve. That's also a sensory nerve. It travels through a hole in the orbit called the optic foramen. It arises from the retina, and its destination is a part of the brain called the thalamus. It functions in vision. Injury causes loss of vision. Number 3 is the oculomotor nerve. It's a motor nerve. Oculo refers to eye, so it innervates some of the eye muscles that move the eye. They travel out through the superior orbital fissure, and the origin is the midbrain, and the destination would be 4 of the eye muscles. We'll describe those in a moment. These muscles move the eyeball, and they also open the eyelids, so an injury to this nerve leads to drooping eyelids. Cranial nerve number 4 is the trochlear. It's a motor nerve. It travels from the brain through the superior orbital fissure. This is a rather large hole seen in the orbit. It arises from the midbrain, and its destination is the superior oblique muscle, one of the extrinsic eye muscles. Its function is to move the eyeball. Injured, the eye tends to look down and out, and you'll understand this in a moment when we discuss the eye muscles. It's sometimes called the bum's eye nerve because it gives the impression of a bum, one eye looking down and away. Cranial nerve number 5 is the trigeminal. It's both sensory and motor, and it has 3 divisions: the ophthalmic, the maxillary, and the mandibular divisions. Let's look at the sensory function first. The first division passes out through the superior orbital fissure. The second one travels out through the foramen ovale, and the third division through the foramen rotundum. They arise from various receptors. The first division from receptors in the forehead, cornea, skin of the nose. The second division from receptors in the nasal cavity, palate, the cheek, the upper lip, and the upper teeth. And the third division arise from receptors of the lower jaw, and skin, and teeth of the chin. Essentially, the first division handles the forehead, the second, the upper jaw, and the third, the lower jaw. If the dentist has to deaden a tooth in your lower jaw, he or she will deaden one of the branches of the third division. The destination for these nerves is the pons. Their function is sensory reception of the skin and teeth. If damaged, there's no blink reflex, and there will be a loss of sensation for the various parts of the face that are supplied. What about the motor component? These are found only in Division 3. They innervate the muscles of chewing, and so their function is chewing. Then there's cranial nerve 6, the abducens. This is a motor nerve. It travels out through the superior orbital fissure once again. Its origin is the pons, and its destination is another one of the eye muscles called the lateral rectus muscle. It moves the eyeball, and if injured, impaired eyeball movement would result. Cranial nerve number 7 is the facial nerve. This is mixed with both sensory and motor functions. It exits the brain through the stylomastoid foramen. The motor component arises in the pons and inserts in the facial muscles and the salivary glands. Its function is facial expression and secretion of saliva. An injury to this part of the brain or the nerve leads to impaired taste. The anterior 2/3 of the tongue is supplied by the sensory component. Its destination is the thalamus. Its function, of course, is taste. And then there's number 8, the auditory nerve. It's a sensory nerve, properly called the vestibulocochlear nerve, as you'll see a little later. It exits the skull through the internal auditory meatus. Its origin is the inner ear, and its destination is the pons. It's involved in hearing and equilibrium, and injury leads to impaired hearing and balance. 9, glossopharyngeal. This is a mixed nerve. It has both sensory and motor. It exits the skull through the jugular foramen. The motor component arises from the medulla, and its destination would be the muscles of the pharynx, that's the throat, and the salivary glands. Its function deals with swallowing and secretion of saliva. Injury would impair taste and result in a poor gag reflex. The back part of the tongue is supplied by the sensory component of this nerve. Its destination is the medulla of the brain. Its function is taste. Then there's cranial nerve number 10. This is the vagus nerve. It's both sensory and motor. It contains 80% of parasympathetic nervous activity. It's one that we'll come back to over and over again throughout the course. In fact, the word vagus means wanderer because it extends down through the chest and into the abdomen and wanders around. It exits the brain through the jugular foramen. It arises from the medulla, that is the motor neurons, and the motor neurons have as their destination thoracic and abdominal visceral organs. Its function is parasympathetic, which we'll get to shortly. parasympathetic function of the thoracic and abdominal organs. Injury leads to a poor gag reflex. The sensory neurons of the vagus arise from skin of the external ear and the back of the tongue. The destination is the thalamus and the function of touch of the external ear, as well as taste. Number 11 is the accessory. It's a motor nerve. It also passes through the jugular foramen. It arises from the medulla and inserts in two of the skeletal muscles, the trapezius and the sternocleidomastoid muscle. Its function, of course, is muscle contraction, and if it's impaired, then the muscle movement doesn't operate as efficiently. And then there's number 12, the hypoglossal. This is a motor nerve. It passes through the hypoglossal canal. Its origin is the medulla, and its destination is the tongue. Glosso refers to tongue. It's involved in speaking and swallowing. Impaired movement of the tongue would be a symptom of injury of this structure. How can we remember the names and the role of the nerves? The role would be sensory, motor, or both. Well, this might help. Here's a list of the cranial nerves by number. And here is a little ditty that may help you remember them. This has been around for a long time. On old Olympus' towering top, a Finn and German viewed a hop. What does it mean? Well, notice the first letter of each word in the poem corresponds to the first letter of the name of the nerve. Olympus is a mountain in Greece, a Finn, a person from Finland, a German, person from Germany. A hop would be a 50s dance that was popular. This column shows their general function, sensory, motor, and both. This little saying was given to me by a fellow graduate student years ago. Some saps marry money, but my brother says bad business marry money. Again, the first letter of the ditty corresponds to whether the nerve is sensory, motor, or both. Let's look at the optic nerve. Assume you're looking straight ahead, the red arrows, and this is a view of the visual pathway looking down from above. Peripheral field of view in each eye includes the temporal, that is, lateral field of view, and nasal, the medial field of view. The optic nerve connects the eye to the optic chiasma. The nerve is not a true nerve, but a tract of the brain. At the optic chiasma, some of the fibers cross. The pathway continues into the brain as the optic tract. The neurons in the optic tract reach the lateral geniculate nucleus of the thalamus. Some of the neuron pathways from the eye to the brain cross to the opposite side, and others do not. Light reaching the retina from the lateral side stimulates the retina located on the medial side of the eye. This is the temporal field of view. The neuron pathway crosses to the opposite side. Light reaching the retina from the medial side stimulates the retina located on the lateral side of the eye. This is the nasal field of view. The neuron pathway does not cross to the other side. Injury to the optic nerve leads to blindness in the eye supplied by that nerve. Injury to the optic tract causes loss of vision in the nasal field of view of one eye and the temporal field of view in the other eye. Injury to the medial side of the chiasma such as the pituitary tumor pressing on the optic tract, causes loss of temporal vision in both eyes. The pressure interferes with the transmission along the neurons that arise from the medial part of the retina. Injury to the brain causes swelling, and the optic nerve bulges into the eye. Let's look at the cranial nerves that move the eyeball. Here are three views of the eye. This is the right eye from anterior view. This is the right eye from lateral view. And this is another view of the right eye from anterior view, showing different muscles. The cranial nerves supply these extrinsic eye muscles. The rectus muscles insert in the eye from straight, that is, rectus, behind the eye. The oblique muscles insert on the eye from an angle. The oculomotor nerve, that's 3, supplies 4 of the eye muscles: the superior rectus, the medial rectus, the inferior rectus, and the inferior oblique. The trochlear nerve, number 4, supplies 1 eye muscle, the superior oblique. The abducens, number 6, also supplies 1 eye muscle. This is the lateral rectus. So how can you remember that? Well, first of all, the abducens is the last nerve to develop. And so in babies, they may be born cross-eyed, allowing time for the other nerves to develop and straighten the eye. To remember the nerves and the muscles, here's what looks like an algebraic formula. LR6 SO4 remainder 3. LR is lateral rectus, 6 is cranial nerve 6, SO is superior oblique, cranial nerve 4. Remainder, the other 4 nerves, muscles, and that would be cranial nerve 3. Let's look at the spinal nerves. There are 31 pairs attached to the 5 regions of the spinal cord. There are 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. The spinal nerves are attached to the spinal cord by a dorsal or posterior root that contains sensory neurons. The dorsal root ganglion contains the cell bodies of the sensory neurons. The neurons are part of the pathway from senses to centers in the central nervous system. The other attachment is the ventral or anterior root. It contains motor neurons. The cell bodies are in the gray matter of the spinal cord, and the neurons are part of the pathway from centers in the central nervous system to the muscles or glands. Spinal nerves contain both sensory and motor neurons. Let's look at the 2 major branches of the spinal nerve. Before we do that, the spinal nerves innervate structures in the skin and skeletal muscle. They include the visceral component, such as smooth muscle in blood vessel walls, hair follicles, sweat glands, and so forth, and a somatic component, the skeletal muscles themselves, stimulating them to contract. The dorsal rami, or branches, innervate the skin and muscle of the back. The ventral rami innervate the skin and muscle of the belly, sides, and the limbs. The internal organs are supplied by the sympathetic nervous system through the white ramus communicans and the gray ramus communicans. Looking at the external anatomy, here's a vertebrae seen from end view. Let's remove part of it to show the cut ends. Line up 6 vertebrae with the lower ends of the spinal cord in the fetus and in the adult. In the fetus, the spinal cord and spinal columns are the same length. The spinal cord reaches its maximum length during childhood, ending at L1. The spinal column, however, continues growing, dragging the spinal nerves down. This forms the cauda equina, a bundle of spinal nerves extending below the end of the spinal cord that reminds the viewer of a horse's tail. This is a view of the spinal nerves. Here is the spinal cord with the brain above it. These are the spinal nerves. These represent the spinal nerves in the cauda equina. Many of the nerves come together to form a network called a plexus. The nerves from the middle region of the spinal cord don't form a plexus. The dorsal rami of the spinal nerves supply skin and muscle of the back, and the ventral rami supply skin and muscle of the sides, belly, and limbs. Looking at the spinal nerves, C1 through C4 form a plexus called the cervical plexus. Its branches are the phrenic nerve supplying the diaphragm. This is quite important, and we'll come back to it when we address the respiratory system. Other nerves supply the neck and shoulder. C5 through T1 forms the brachial plexus. This gives rise to the posterior cord that branches into the axillary nerve supplying the shoulder, or radial nerve supplying the arm, forearm, and hand. The medial cord branches into the ulnar nerve that supplies part of the arm, forearm, and hand, and a median nerve also supplying the same structures. The lateral cord becomes the musculocutaneous nerve, supplying also the arm, forearm, and hand. Dermatomes are regions of the skin innervated by the spinal nerves. Thoracic 2 through thoracic 11 form the intercostal nerves, and they innervate the lateral and anterior body wall. Notice they do not form a network, a plexus. Thoracic 12 through lumbar 4 form the lumbar plexus, and that plexus gives rise to the obturator nerve supplying the thigh, the femoral nerve branching into the anterior femoral cutaneous nerve supplying the thigh, leg, and foot, and the saphenous nerve also supplying the same structures. Lumbar 4 through sacral 4 form the sacral plexus. This becomes the sciatic nerve that branches into a tibial nerve supplying the leg and a common peroneal nerve or fibular nerve also supplying the leg. There are other nerves that supply the thigh. Note that the sciatic nerve is actually a bundle of the common peroneal and tibial nerves. Part C is the autonomic nervous system. We'll look at characteristics, anatomy, and a few examples of its function. The autonomic nervous system is a visceral motor subdivision of the nervous system. Hypothalamus is its major control center. It deals with visceral sensations. The autonomic nervous system is a two-neuron pathway between the central nervous system and the target tissues. It consists of a preganglionic neuron and a postganglionic neuron. It has two subdivisions, the parasympathetic nervous system, PNS, and the sympathetic nervous system, SNS. The origin from the central nervous system varies. Peripheral, the PNS arises from the cranial and sacral regions. The sympathetic nervous system arises from the thoracic and lumbar regions. The ganglia are located close to the target organ in the parasympathetic nervous system and close to the central nervous system in the sympathetic nervous system. They form a chain of ganglia, referred to as the sympathetic chain ganglia. help you understand the complexities of the autonomic nervous system, I've placed the organs into three groups. Groups 1 and 3 are supplied by both the parasympathetic and the sympathetic nervous system. Group 2, on the other hand, is supplied only by the sympathetic nervous system. The adrenal medulla has no postganglionic neurons, only the preganglionic. Why is that? Because the adrenal medulla arises from highly modified postganglionic sympathetic neurons. It secretes substances very similar to the neurotransmitters involved. Let's look at the neurons of the autonomic nervous system once again. This is a slightly different view from the previous. Here are the presynaptic neurons of the parasympathetic nervous system, presynaptic neurons of the sympathetic nervous system, postsynaptic neurons of the parasympathetic system, and the postsynaptic neurons of the sympathetic nervous system. Understanding the role of synapses will go a long ways in your understanding of the autonomic nervous system. Between the preganglionic and postganglionic neurons, the synapses are nicotinic cholinergic and are always excitatory. Between the postganglionic neuron and the targets, they may be muscarinic, cholinergic, excitatory, or inhibitory. These are found in the parasympathetic nervous system and in some of the sympathetic nervous system synapses. Most of the synapses from the postganglionic neurons of the sympathetic nervous system are adrenergic. Specific neuron pathways are described next. Sympathetic pre- and postganglionic synapses and parasympathetic pre- and postganglionic. Let's look at the pathway followed by the sympathetic preganglionic neurons. The cell bodies are located in the lateral horns of the spinal cord. The axons extend through the ventral root of the spinal nerve, through the spinal nerve itself, and down the white ramus communicans to sympathetic chain ganglia. Some of the axons continue up toward a higher level, that is toward you in this view, or down to a lower level, a more inferior level, that would be away from you in the figure. Many, however, continue through the ganglion to the collateral ganglia. In the ganglia, the preganglionic neurons synapse with the postganglionic neurons. Let's look at the sympathetic postganglionic neurons. The cell bodies, as described, are in the ganglia. The axons from the sympathetic chain ganglia may extend up the gray ramus communicans into the dorsal ramus of the spinal nerve to innervate the skeletal muscle and skin of the dorsal part of the trunk, or within the ventral ramus of the spinal nerve to the skin and muscle of the ventral and lateral sides, as well as the upper and lower limbs. The axons from the collateral ganglia, on the other hand, they're found in various nerves and they extend to different internal organs of the body. They synapse with the target organs. Parasympathetic preganglionic neurons. The cell bodies are located in the cranial nerve nuclei in the brain and in the gray matter of the sacral region of the spinal cord. The axons that extend from the brain through cranial nerves 3, 7, 9, and 10, and they extend from the sacral region of the spinal cord in pelvic spinal nerves. They synapse in ganglia associated with the target organs. The postganglionic parasympathetic neurons generally have cell bodies in the ganglia, and the axons extend within the target organ. They synapse with the target organ. Here is a brief summary of the function of the autonomic nervous system. Details will come when the various organ systems are covered. The sympathetic and the parasympathetic nervous systems have opposite effects on target organs. Both are continuously active. Remember that we have said that control systems are not so much like on and off switches, but more like a volume control on, say, your TV. It can be turned up or turned down. The parasympathetic nervous system is more active during day-to-day activities, during rest and relaxation, sometimes referred to as feed and breed. The sympathetic nervous system is more active in coping with stress, fight or flight. The sympathetic nervous system increases the heart rate, increases blood flow to skeletal muscles, dilates the pupils, decreases the activity of the digestive system, dilates air passageways. On the other hand, the parasympathetic nervous system decreases the heart rate, decreases blood flow, skeletal muscle, constricts the pupils, and increases the activity of the digestive system. It constricts air passageways. Let's look at the symptoms of nerve gas poisoning. This will help illustrate the role of the autonomic nervous system. A type of organophosphate is what poison gases are. Examples would be pesticides like malathion and nerve gas like sarin. They block the acetylcholinesterase, that is, the enzyme that breaks down the acetylcholine. Thus, the action of acetylcholine is increased because it remains in the synapse. Initial symptoms involve a runny nose, tightness in the chest, and constriction of pupils. This is followed by difficulty breathing, nausea, drooling. Later symptoms involve salivation and tears formation, urination, defecation, vomiting, and gastrointestinal pain. Then seizures result. Death finally is due to respiratory failure. Antidotes include atropine, which blocks the acetylcholine receptors. Thus, the action of the acetylcholine is decreased. This is the end of parts B and C of the functional nervous system. You're now ready to progress to part B, the first part.